And can I get your name, age, and date of birth?
My name's HT and I'm 32 years old and my birthday is 02231988.
Okay. And what medications have you been on for your condition?
I don't take any medication.
Guys, we're gonna start cleaning out. Like one more practical. That's all we have time for.
What symptoms are you having?
I have trouble speaking. I have to take a second to breathe, and I usually have wheezing also, and I get a lot of chest pain.
Shortness of breath?
Yeah,
Okay.
and my heart beats really fast.
Alright. When did these symptoms first occur?
I don't know, I've had it for a while. I just didn't care to do anything about it.
Do you have any reasoning for your symptoms that you know of?
I've been smoking since I was 15 years old, and I have asthma for 20 years.
Okay. Okay. And have you started any medications over the counter?
No,
Have stopped any medications?
I haven't taken any medication.
Okay. Well, I'm gonna bring this to the doctor and I'll be right with you.
Thank you.
I'll be back in a moment.
Hi, HT.
Yes.
Alright, I am Dr. Kenzie. I just heard about what's been going on, so we're just going to check your peak flow meter. And I don't know if you've heard of that before, but it's basically just testing like the fastest speed at which like you can exert air from your lungs. So we're just going to test that to see if anything unusual is going on. So it's just right here. So this is like, just to explain it real quick, this is the goal of what we want to be able to get you to breathing wise. And this is like, you did it, you're almost there, it's not bad, but if it's below it and it's in the red, then that could be bad. So we just want to test that. So all you're going to do is you're going to put these nose plugs on. Okay. And then you get 3 shots at this just to see if it can get stronger on either of the rounds. So you're just going to take a deep breath in and then blow into that as hard as you can. And, okay, whenever you're ready. Okay, good. All right. Okay, you get 2 more tries, so we're just going to test that. Let me just write that down. Okay. Good, okay. You get 1 more shot. Nice. Okay.
HT? Thank you. Come right this way to our exam room. You can take a seat and the doctor will be in right with you.
Okay, thank you.
HT? Hi, I'm Dr. Pierce. Okay, so I took your peak flow meter and we checked your levels for it, and the normal range for it is typically 300 to 500 liters per minute, and yours was 150.
Oh,
So it is kind of severe, but we just want to take a few extra tests to see if anything else is abnormal. Is that okay?
yes.
Okay, so we're just going to do a physical exam real quick. So I'm just going to start, you check your heart rate. Okay. Can you take a deep breath in from your exhale? Okay. Can you step forward for me real quick? Okay. I'm just going to tell you the breathing. Take a deep breath. Exhale. One more time. Good. So your breathing is a little raspy, but it's not in the normal range either, so we might have to check some other things. So typically we would do an EKG and a chest x-ray along with an oxygen test, such as the peak flow, but we just had to check for any signs of congestion or heart murmur or anything else that may be irregular. So we should probably check your blood pressure real quick to see if you have any tachycardia or anything like that. So right here real quick. If I can get this. Alright. Okay, just need to real quick. So it's just gonna tighten up real quick. We're gonna see your blood pressure. Okay. So you do have a high heart rate right now along with blood pressure. The normal resting heart rate is a lot lower and yours is around 130. So that could be a potential issue. And your blood pressure, the typical range is like 120 over 80, and yours is 150 over 70. So we might have to talk about some plans that can help this situation. I'm gonna be right back. I'm just gonna go talk with my assistant, and we're gonna figure out some treatment plans and anything else that can help you with like your daily like living lifestyle that can potentially improve it. So we'll just bring you over to the counseling room real quick if you want to follow me. You can just wait right here and I'll be right with you. Okay, so let's talk about treatment plans for her. Okay. So we did take her peak flow meter and she is abnormal with that. She's at 150 liters per minute, so that's pretty bad. And she also has signs of tachycardia. Her pulse was at 130 beats per minute, and she is tachypneic. Okay. And so her respiratory rate is 25 breaths per minute. So we did learn that she does smoke, along with living on the 10th floor of her apartment building. So that can add to the tachycardia. Yeah. But other than that, I'm thinking she needs to maybe change her lifestyle, maybe try and give up smoking, so we can talk about treatments for that. Okay. And the different medications she can take. Did you find any for?
I found Pro Air,
Okay.
as well as the
Brand.
which is albuterol.
Okay. So we might just need to also talk to her about exercising more and just maybe just beginning like a healthier lifestyle. So that can help with it. All right. So we can see if we could prescribe her with something today. So all right, let's go talk to her.
Okay.
Hi, HT. Yes. So me and my assistant talked, and we were discussing treatment plans for you. So we do think that a huge part of what is going on, like with your symptoms and everything, that smoking has impacted that a lot, and it's in a negative way. And I know you've been smoking for a long time, and it is a very difficult thing to give up, but we feel like it's for the best, and it can potentially help your health, and that will help these symptoms decrease. And along with that, we also do realize that from this, you do have asthma. So we were thinking that including exercise, which would help your health as well. And it may be difficult when you do have asthma, but just like consistent, steady workouts every day, like will help potentially like increase like your health benefits, and these symptoms could go down, and it would help a lot. And
Maybe
just
improving diet as well, like a whole entire lifestyle change. We have pamphlets to walk you through everything to make it easier and more treatment-wise.
Okay, so we also found medications. My assistant has found some that we could possibly prescribed to you today. So there's, what all is it?
Albuterol. It'll help with your asthma and keep you more able to breathe.
Yeah, so, okay, so we do realize that during this time in this process, it is very hard to change your lifestyle, like your eating habits, regularly exercising, and just remembering to take your medications. But that's why we have come up with some plans that can help with that.
So we do have treatment plans. Albuterol will help, but that's only going to help with asthma. And we have other therapies, and even to the point if you are very serious about your treatment plans, we can access rehab and different support groups.
Thank you.
Of course.
Okay, so, I mean, same with the medications. If you do have any questions about them, because this is a new thing for you that you're starting, it's a new step in your life, so it does mean you will have questions. And if that's the case, you can always call your pharmacist, and they can answer any questions about your medications that you may have. So, and you can always go in there and get personal counseling for it, and they'll take you into a private room in case you feel embarrassed about anything talking about it. So if you have any other questions, just please let us know.
And we just need to write up the prescription, and I'll be right back with you, okay?
Thank you so much, guys.
Thank
Thank you.
So this is your prescription for the albuterol for the asthma, but due to your tachypnea and tachycardia, you are at risk for a high heart rate as well as high breathing. So a normal is 60 to 100 and yours is at 130 BPM. So that is very severe, and you want to take the measures to be taking your medication normally, not raising it at all. Also for your normal respiratory beats, it's usually 12 to 16 and yours is at 25. So working on that is very important as well.
Okay.
All right.
Thank you so much.
And make sure to ask your pharmacist any questions you have about your prescription.
Thank you.
All right.
Thank you.
Of course. All right. We can head out this way.
Okay. Thank you. Hi.
Hi.
I'm here to get a prescription.
All right. Oh, I can have this right with you. Just take a moment in the seating room, and I'll be right with you.
Okay, thank you.
HT. Hi, are you HT? All right. Can we move over to the private room so I can discuss a few questions about your medication? So this is albuterol. I want you to use it before any exercise. It prevents your asthma symptoms, and 4 to 8 puffs every 20 minutes, up to 4 hours, and 4 to 8 puffs every 7 to 4 hours as needed.
Okay.
All right, and if you have any questions, just give us a call or come by, and glad to answer anything.
Thank you so much. Thank you.
Of course. Have a lovely day.
Thank you. Hey, I was in the parking lot. I was looking over my medication. I have a few questions. So, what triggers my asthma? Like, do you know?
Your first name is HT, correct?
Yes, HT.
Okay. And date of birth?
February 23rd,
8.
Okay. You're talking about the albuterol for asthma, correct?
Yes.
Okay. Well, with asthma, there can be quite a few triggers. High intensity workouts, keeping up with your lifestyle changes, making sure that when you're taking your medication, it's done regularly.
Okay.
Smoking.
Yeah.
And I see on your charts that you are a smoker,
Yes.
and that will trigger it.
Yes.
So those are things that you want to watch out for, definitely. But the medication will help, and I would just keep up with your lifestyle changes. Thank you for coming and communicating with us.
Thank you.
if you have any more questions, just come to us and I will be glad to answer them.
Thank you so much. Thank you.
Of course.
Hi, pharmacy technician. My name is Dutu Sadashian, born in 1990-69. Can I get some perks 300, please?
So where's your prescription?
Okay.
Get your health. So,
City is not
Hey,
a
you
joke.
have
It's
to
a genetic condition that you can't even fix.
I'm not laughing.
Hit the gym.
Sorry.
Wait.
Yeah, actually.
end scene.